Pen France and AJ has litigation against SASA, DSD at the moment. And Treasury has also asked actually to be the third respondent for some reason. But we also think that's just a tactic to delay the case. But that fits right into what we're discussing here today, because in Treasury's answering affidavit to us regarding the litigation, they are saying that the government does not have any money, because we are fighting for an increase in the SRD grant or a universal basic income grant to be implemented, because the SRD has been 350 since 2020 when it was implemented. And I mean, it's 4 years down the line now, and what can 350 buy you actually? Because I would really like to see the minister live on 350 a month and see how she survives on that 350 that she expects you to survive on. So I just want to share a few stories of what's happening actually with the grants. Okay, currently I do groundwork. So I go with beneficiaries to the local SASA offices and I try and go solve the issues. Because for some reason, our beneficiaries, especially our old people, are being mistreated by SASA staff. I've actually submitted a few videos that I actually took last week at my SASA office, that where our old people are actually saying that they have to beg for their old age grant. Some have been going to the SASA offices for the past 6 months. And they come every day and they will be told they must come back next week and they must come again. And when they query, they are being told that SASA is understaffed and government has no money to fill the positions. So my local SASA office serves the Greater Eldorado Park, Freedom Park, and Slovo Park. Eldorado Park already is overpopulated because of all the backyard dwellers. Because as you know, we haven't received any houses for the last 4 generations. So 4 generations is actually living on one property. So that's how overpopulated we are. And in our local SASA office, we have like 4 staff members that's serving this community. And they work at such a slow pace. I was actually disgusted last week when I saw that they take 1 hour with 1 beneficiary. And that is just to do your screening. And then they will tell you you must come back in the next 3 weeks or 4 weeks to submit your paperwork. Which I know is not right, because when you're there, they're supposed to do the whole procedure. Some of our old people can't even walk properly. Some are on medication, and they have to come and queue from 5 o'clock in the morning until 4:30 when the SASA office is closed, just to be told they have to come back. This is how our people have been treated. Second of all, I do think you guys know last month that the CSG grant was 150,000 caregivers grants were suspended last month. And I actually went to the SASA offices to go query what was the reason for these suspensions, because schools were opening. The last CSG grant was early in January, schools were opening, and when the caregivers went to the bank, there was no money. And you guys would not believe it was silly issues. Oh, your initials is not the same like on your bank statement. Your bank statement only has 1 name and your identity document has 2 names. And they were actually suspending grants for this reason. And for the whole month, these kids were going hungry. Until now, in February, when they received the grant. Now, I feel our social department can do better. Because it is your right to social assistance if you can't take care of yourself. So, if our government can look after our old people, first of all, that tells a story. 2,000 rand. What is 2,000 rand? 2,000 rand is nothing to survive on for an old person. They've worked all their life. They pay taxes all their lives. and yet now they have to survive on that mere 2,000. And some of these old people also have to like support their grandchildren with that same 2,000 rand. So at the end of the day, they can't even take care of themselves. So I would really ask the minister to look into all these issues and really look at the plight of how many people are going hungry. Just last year, 2 mothers I know, one in Port Shepstone and one in Umtata, killed themselves with their kids because of starvation. And the news didn't make a big fuss about it. They didn't even write an article about it. But this was all because the department failed them. That is the main issue here, the department failed them. Then I would like to come back to the SRD grant. I don't know if you guys are aware that every child that's turning 18 years old, when they do apply for the SRD grant, it says grant already active. So someone has already applied for this 18-year-old. Someone already uploaded bank details to receive this grant. And what will SASSA do if it happens to you? They will tell you, no, you need to go to Home Affairs, you must go fetch a harness letter, and then you must take fingerprints, and then you must send it to the call center. Where must these beneficiaries get money to go to Home Affairs? And how are they supposed to survive, especially the children that's in school, that's turning 18 in school and they're coming from CSG. CSG is 510 rand, and now it gets cut because you're turning 18 and now you're only receiving a 350 rand. So how are these kids supposed to survive? So I really don't think that our government is fair towards any beneficiaries, and I do think they can do better.
So this is the quote to start it off. It's my favorite, which is that medicine is a social science, and therefore politics is nothing but medicine on a larger scale. One of the major ways to define the healthcare sector in terms of its structure is the WHO building blocks. These are the 6 building blocks that make up a health system. And it's a useful framework because you can use it to understand which are the specific areas in which financing is going to impact your health system. So it's going to impact leadership and government, it's going to impact healthcare financing flows, the health workforce, medical products, information and research, and then finally service delivery. Service delivery is the one that's often in the media, but all of these other factors lead to the outcome that we see. Okay. This is just some quotes from an article from the statements made by the Minister of Health recently about unemployed medical doctors. So there's 825 recorded by Zama unemployed medical doctors who are seeking employment in the public sector. So it's not, I happen to be an unemployed medical doctor as well. 694 post-community service. There's been an annual increase in community service posts every year, 2,101 in 2024, as well as an average increase in the number of internship posts every year, but the number of posts post-conserve and post-internship has stagnated, leading to an increasing number of doctors who every year are looking for employment in the public sector. The Minister of Health has promised by the 1st of April to employ all of these doctors. We'll see. All of these challenges that we're going to get into are exacerbated in a rural area because there's limited access to specialized care, there's limited access to equipment due to distance, sheer distance, difficulty in recruiting and retaining professionals, limited resources and technology, and also issues of transportation, housing, and food insecurity. And again, distance is a specific determinant of health that you'll see in some of these anecdotes. Okay. So the first little adage is that a rand spent now, or not spent now effectively, will cost you 100 rand tomorrow. What we've seen is that, especially at the district level, because you're struggling with your limited budgets, you have to pick your battles, and the battles that are often picked are the ones that are visible in terms of treating patients that are right in front of you in your emergency room. And therefore, there's very much a limited investment in preventative medicine and care, and what Lydia spoke about earlier about community health workers our hospital had very limited access to community health workers. In fact, the entire district had very few community health care workers, meaning that patients are relying on care at the district hospital level or at the clinic level. And when those services are oversubscribed, nurses and doctors don't have time to do the necessary work of making sure that there's a successful follow-up plan for patients, so you get wastage expenditure. Obviously, we lack specialist services. I'm not going to deny that. We lack outpatient services. We lacked the problems we specifically struggled with were ultrasound, CT scans, and echo scans at our referral hospitals. But the point I'm going to make is it's not just all about investments in these major centers. It's about finding a way to improve the healthcare from the ground up. Okay. So at the time, when I left the hospital in December, both our secondary hospital and our tertiary hospital did not have a working CT scan. Meaning that's CT scan. So meaning that there's a portion of the country that is, this is true in other provinces as well, that cannot access a CT scan. At the same time, both our secondary and tertiary hospitals didn't have access to a G-scope, a scope for ulcers. So if you happen to be in that part of the province and have an upper GI bleed, a bleed from an ulcer, you die. That's just the case. Unless you could give a patient money to go to a different city. That's the impact that we had on the functional level. Okay. Orthopedics, we always need orthopedics surgeries. And there was a shortage of hip and knee prosthetics, which meant that we had patients waiting in our ward for weeks and weeks for hip replacements, which should be done in 2 to 3 days. And again, back to the CT scanning and imaging, we didn't have that. Lack of interfunctional IT services, meaning that if somebody has a scan at my tertiary hospital and I want to see the scan, I can't do that in my province because there is no single patient number for the Eastern Cape. And it's true in many other provinces. The Western Cape does have a single patient number, but it's not the same across the whole country. Meaning patients who eventually get to the CT scan, quite a few months later have to get to a CT scan again because we don't have the images. Then, of course, lack of access to elective procedures. And the final area of waste, which is often missed, is lack of rehabilitative services. So of the 3 knee replacements that were done in our drainage area at our tertiary hospital since COVID, only 3 knee replacements. A 4th one was done. It was sent to our hospital 1 month later for physiotherapy services. We don't have a physiotherapist. This patient now has a knee that doesn't work. So if you did 4 surgeries, 1 of them was a waste. You can start to see the waste in the system because of lack of investment in both preventative and rehabilitative services. Taking from Peter to underpay Paul. Again, there's this idea that we have to plug holes in the system wherever they pop up. So a hole in the system pops up, we find money for it, we plug the hole in the system, and then a new hole pops up without any sort of planning of how we're going to prevent that from happening. So there were lots of stockouts at a provincial level last year in the Eastern Cape. Stockouts have happened in other provinces too. There was a problem with the depot and with the ordering and procurement of pharmaceuticals, and the pharmaceutical companies which are not being paid due to austerity measures and ways in which budgets are being redirected to fix holes were therefore not supplying the next year's stock. So we had stockouts of everything from Panado to IV medications to cannulas. So you see how, again, a problem now will lead to a problem later. Building safety, disaster management, and equipment services, because you don't necessarily have to fix something every year, means you can get away, especially if it's not an election or if it's an election year, with making expenditure that's public and not investing in the expenditure that you should be doing behind the scenes to keep your hospital functioning. And so that delay protects you until the next election cycle, where now the budgie hits the fan, and we have no anesthetic machines that are working and no ECG machines that are working. All of these things happen at the same time because there hasn't been investment in ongoing repair and maintenance. And that leads to a lack of resiliency. We saw during the Nauru strikes that we had lack of linen supplies, food supplies, and ambulance shortages. Okay, because any extra work the health system has to do incapacitates it. skilled health workers do not stay in the public sector just for the salary. So this is another point that I'd like to make. Well, of course, we do have the case, and this is a studied point. We have the case where people leave South Africa to go work overseas. It's not always as demonstrated by interviews, and so therefore people don't feel that they're in a responsive system that really cares about them as a healthcare worker. They of course are overworked and overburdened, and lack of career progression. And all of these factors together make it such that people are leaving the public sector. And then this is a point to one of the questions earlier. If you do not search, you will not find. So why do we not have all of these cases of non-communicable diseases and cancer and things being identified? Is because of the stress on the healthcare system, that people are dying from diseases that we're not adequately investigating or working on. If a patient comes into my hospital and has a chronic cough and I treat them as a pneumonia, but they're also a smoker and I want to do a CT scan to see if they have a lung cancer, because I can't do the CT scan, that patient dies as a COPD or an asthma patient. Okay. And so therefore mortality hides an underlying morbidity. So that's one of the reasons why the statistics are not always adequate. And when we do studies on areas, we find that we do have these cases. If you do invested studies with really investigating the morbidity there. And it leads to poor quality of death data. And then there's this cycle that happens, which is that if I report for my hospital a certain number of deaths from different conditions, that is going to be used to motivate for the fiscus for the next year in terms of how many doctors are needed or how many nurses are needed and what services are needed to be done in my hospital. But because I'm underdiagnosing, I'm getting less resources the next year, less medical officers, etc. Less staff leads to poorer treatment outcomes the next year, and overwork on the existing staff, which leads to further worse diagnoses the year that follows that. So it's a cycle that is exponential in a sense. Time wasted is wasted time. So one of the most clear things you'll see when working in the health sector and the public sector is that there's a constant chain of delay to care. So from lack of medical education leads to people not getting access to community care workers, leads to lack of screening, leads to delay in treatment, leads to delay in seeking care, delay in diagnosis, delay in ambulance transfer, delay in getting to the specialist, delay in getting the procedure after you've gone to the specialist. And all of that leads to lack of follow-up in the whole, lack of follow-up, which leads to lack of trust in the health system, and therefore you don't go to the health sector in the first place. And again, you get a cycle. Okay, so this can be the case. Why would you, if you have your knee replacement, and you see somebody with a knee replacement, and they're only 1 of 4 people who got it, want to go to the clinic for your arthritis medication and your behavioral change, if that one patient that did get the knee replacement ended up with a frozen knee? So like, all of these reasons are why we see patients presenting very late with HIV, TB cases, and in very advanced stages of all forms of disease, because there's one of the things that's not talked about is that we lose trust gradually in the health system, particularly in the public sector.
For those who don't know equal education is a movement of learners, parents, community members fighting for quality and equal education through activism and analysis. We've been fighting for quality education for 16 years now, and will continue to do so until all Black learners get quality education and equal education. So I'll be stating what implications does the austerity have to education system. So as an organizer that is working on the ground, also we've been advocating for quality education and also advocating for government to bring back the money that they have cut to the education system, because there are implications that does to the infrastructure backlog. And also as equal education, we are in 5 provinces, and each province has a different campaign that also like that is being affected by the budget. Even now, this year, as Equal Education in the Western Cape, we've been assisting parents that have learners that are unplaced in that. The budget cut has contributed to that because most teachers have also raised that they are facing overcrowding now because they have to take more learners in class while there are no classrooms that are being provided by the Department of Education, whereas they've cut 2.1 billion in 2021 and also like failing to provide the proper infrastructure for all students in South Africa. So as Equal Education, we are advocating for that, and also we are calling the national treasurer to reverse back the money that they've cut to education so that all learners and students can have the access to their basic education, as it is their constitutional right to get the basic education.
I'm from IYM. It's called Intlungu YaseMatyotyombeni. It's a movement that has occupied vacant land in Kailicha and put our shacks there because we saw there's no way that government can build houses for the poor people. Then we extend to other areas in Danun, Kaifonde, pushing and mobilizing that people must go and put shacks in vacant land because government, they know that they will build houses. So I'm going a lot on these slides because everything was explained this morning. Squeezing the poor, as you know, government doesn't want any poor people to flourish. I think that this word is dominating here. And also what they are doing is amending some laws that allow them to loot the state resources with the private companies. We know, I think ESCOM and other SOEs, there was an act or something, a law that ESCOM is not obliged to disclose its financial finances if they made a loss or profit. That's not our problem, it's a problem of ESCOM. So government taking over your private company is taking over government responsibilities. So that's the problem for us, poor people. So I'll go along because people, earlier speakers spoke a lot about these austerities. There was an apartheid here, which didn't do anything for us as black people. I mean, colored, Indian, Chinese, and other things, other racial. So when we go to the democracy, ANC government failed to close the gap of apartheid, but instead they reinforced the apartheid special planning, implemented gear policies back then, and then there was a lot of people that needed the houses, and then they couldn't deliver those houses. So the austerity on the impact of austerity on housing is a sight and service. First of all, there's an issue of people being given land. They will see what they will do on that land, whether they will build a house for yourself or what you do, but it's all up to you. So for us, it's wrong because government must provide those houses, must build houses and allocate people to those houses. You can't just give people land and then they will see what they will do, whether they bring a brick house or zinc house, it's up to them, it's wrong. And also the issue of waiting lists. I think we know there are people that have been in the waiting list for over 40 years, 30 years before the democracy, some of them are still waiting on the list. Some passed away without getting those houses. And so there's no way, hence, with my movement, we decided that we don't want to be that generation. We want to do our own thing, take the land and put our shed in, and we'll see whether we build when we have money. So waiting list is a problem as well. It's one of the impact of austerity in terms of housing. And this is done by the ANC government. Now the ANC government that's in power. we need to stress that, because I was a bit disappointed in the morning. Some of the speakers didn't stress that it's ANC. So comrade, and also this issue of social housing that they are proposing for us poor people, but it's not of poor people. It's a money-making scheme, because here's a bank inside. Bank are the people that are the institutions that are behind this social housing. So for us as a Intlungu, it's not for us poor people. Yes, you can start from 3,500, but if you are unemployed, then you're out from that. So it's a problem for us. And also the bond houses and apartments that are being built now all over. So unemployed, you are poor, then you are cut off. You don't get anything from that because of your economic status. And also there's the issue of land, comrade. The land is a problem in South Africa, and we've got the land, plenty of land, but you are told the land is for private investors. They want to build firms, factories, malls, while we want houses. And it's a problem for us as Intlungu and other people, because we see a lot of malls in our areas now, and see house being built. So it's a problem. And also the land, that is, I think someone mentioned the issue of there are people who don't want poor people next to them. I think, of course, it's not that you want to stay in Kailicha, in Doubt, in Harare, or Nyanga, Manenberg. You want to stay in town as well, but because of the market forces and the land, don't go in there. So we cannot stay there, but we want to. So those are the issues of land and other issues. Yeah. And also the issue now, there's a Monday went to the public hearings. The minister want all the powers to her combined. She want to know what is happening in these areas, who built what. She want to the powers to build or not to build houses. Local government or provincial government cannot do anything about that. So there's a bill that is proposed, and she's proposing that there are private developers that must be involved. So again, it's a privatization of houses, and those houses only free. People must be obliged to get paid, have a salary or pay slip in order for them to get those houses. So there's a lot of things. I think the housing backlog in South Africa is maybe small, but it's 2.3, no? Come on, 2.3. Yeah, nationally. And then provincial, I think it's around close to 1,500,000 and something, but the number is more now. I don't think it's the same number. So, comrade, all these things impact of austerity for us poor people. Now we saw on the newsletter in Kailicha called Fugani. It's a paper that is delivered freely every Thursday. That they want to upgrade Sea Point, all the Atlantic Sea Point, Grid Point, with 40 million, it's 40 million. While the DA government was given by Kubai, but we're not sure about it, 111 million to upgrade our shacks. That was last year, Christmas. Yeah. And then the DA decided, because they always portray themselves as ethnic, moral, while they are corrupt as well. That, they return the money to the tribes of God. They said that money is not legal, it's illicit. ANC do what they do. So instead of upgrading our shacks for 2020, they return the money to the treasury, while they want to upgrade Sea Point or Atlantic Seaport, all these areas in town. So it's an issue of we are poor in Kailicha or in Delft, in Manenberg, so our areas cannot be upgraded or developed. Instead, they are developing the areas that they are getting vote from, this employment in other areas. So it's a problem, comrade. It's a big problem. So we proposed this to the government many years ago that in order for us, this is a reformist in fact, not talking about socialists of taking over the means of production. It's just a reformist that we can do at the moment while we're mobilizing to take over the means of production.
Change the language.
Yeah. So we said government must create a construction company that will build houses, hospitals, clinics, all these type of infrastructure, and employ people and train them in playing, plumbing, all these necessary skills when you build a house. And also we said one of the things that they can do to buy or expropriate land for building houses. There's a law in South Africa that was used in apartheid, disposal act. Apartheid used it when they want to take the land, and that law is still valid now. Government can use that. If they saw vacant land, they can take that land and develop it, put infrastructure, and then give people not money, like coupons where they will buy building materials, and those houses can be built by people that will trained by the government. Just to run away from this private sector. Because the problem that we are not getting houses, austerity problem, because of the private sector. Private sector is a problem in our life. Yeah. So yeah, the prayer I'm comrade. Sure.